Hi. Today we want to talk about irritable bowel syndrome or IBS. We will talk about definition, symptoms, diagnosis, and different treatments for this syndrome. Irritable bowel syndrome, IBS, is a common disorder that affects the stomach and intestines, also called the gastrointestinal tract. Symptoms include cramping, abdominal pain, bloating, gas, and diarrhea or constipation, or both. IBS is a chronic condition that you'll need to manage long-term. Only a small number of people with IBS have severe symptoms. Some people can control their symptoms by managing diet, lifestyle, and stress. More severe symptoms can be treated with medication and counseling. IBS doesn't cause changes in bowel tissue or increase your risk of colorectal cancer. Symptoms of IBS vary but are usually present for a long time. The most common include abdominal pain, cramping or bloating that is related to passing a bowel movement, changes in appearance of bowel movement, changes in how often you are having a bowel movement. Other symptoms that are often related include sensation of incomplete evacuation and increased gas or mucus in the stool. There are specific symptoms that are not related to IBS, and you will need further evaluation by your doctor. Some of these symptoms are weight loss, diarrhea at night, rectal bleeding, iron deficiency anemia, unexplained vomiting, pain that isn't relieved by passing gas or a bowel movement. There's no test to definitively diagnose IBS. Your healthcare provider is likely to start with a complete medical history, physical exam, and tests to rule out other conditions, such as celiac disease and inflammatory bowel disease or IBD. Your provider may recommend several tests, including stool studies to check for infection. Stool studies also can check to see if your intestine has trouble taking in nutrients. Additional tests may be recommended to rule out other causes of your symptoms. Some common diagnostic procedures can include colonoscopy, upper endoscopy, or CT scan. Some lab testing may be done to rule out other possibilities such as lactose intolerance test, testing for bacterial overgrowth, or stool testing. After other conditions have been ruled out, your provider is likely to use specific diagnostic criteria for diagnosing IBS. For the purpose of treatment, IBS can be divided into 4 types based on your symptoms: constipation predominant, diarrhea predominant, mixed, or unclassified. Each category of IBS has different medical treatments. Treatment of IBS focuses on relieving symptoms so that you can live as symptom-free as possible. Mild symptoms can often be controlled by managing stress and by making changes in your diet and lifestyle. It is important to try to avoid foods that trigger your symptoms. Eat high-fiber foods. Drink plenty of fluids, exercise regularly, and get enough sleep. Your provider might suggest that you eliminate specific food from your diet, such as high-gas food, gluten, or FODMAPs. FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. FODMAPs are found in certain grains, vegetables, fruits, and dairy products. Please make sure to check our other video about the low FODMAP diet as well. Based on your symptoms, medications may be recommended, which may include fiber supplements, laxatives such as Miralax, antidiarrheal medications such as Imodium, anticholinergic medications such as Bentyl. Some antidepressants can be used to treat symptoms of IBS. The dose used for IBS is much lower than what is used in depression. The role of alternative therapies in relieving IBS symptoms is unclear. Ask your provider before starting any of these treatments. Alternative therapies include peppermint. Studies show that, in people who have IBS with diarrhea, a specially coated tablet that slowly releases peppermint oil in the small intestine, enteric-coated peppermint oil, eases bloating, urgency, abdominal pain, and pain while passing stool. Probiotics. Probiotics are good bacteria that typically live in your intestines and are found in certain foods, such as yogurt, and in dietary supplements. Recent studies suggest that certain probiotics may relieve IBS symptoms, such as abdominal pain, bloating, and diarrhea. Stress reduction. Yoga or meditation can help relieve stress. You can take classes or practice at home using books or videos. The most important thing to remember is that IBS does not cause any long-term damage to GI tract despite of disturbing symptoms. Long-term changes in diet and lifestyle are key components of managing this syndrome. It is important to know that IBS symptoms will have fluctuations, and it is necessary to learn how to live with the symptoms of IBS. I hope you enjoyed this video. Please share your thoughts and comments below with us. Stay safe and get healthy.